India's testing level for COVID is at 60% of last year, the same period. Is this a smart move or is this a dangerous policy? I'm Barkha Dutt and you're with the Mojo story. Our big focus today is on Omicron and the testing debate. Let's take a look at the key developments in this unfolding public health debate. The center is asking key states to ramp up testing as testing for the third wave in particular states has fallen significantly in the last week or so. Nationally, the testing samples are on the rise, but in key states, which include Delhi, Maharashtra, Bihar, Andhra Pradesh, Bengal, and Rajasthan, the testing has fallen. There is one view among epidemiologists that the third wave needs a new rules, and given that Omicron is in widespread community transmission, the old idea of testing, tracing, and isolating is now, in the words of Dr. J.P. Mulyal, worthless. Is that really the case? Do we need to be testing, if for nothing else, for public health data, for research to know exactly how deep and widespread the transmission of Omicron is? Or should our attention be turned towards hospitalizations and mortalities? Let's introduce our panel of experts today. Dr. Trupti Gilada is back with us after a while. It's good to see you again. Trupti, welcome back to the program. Dr. Chandrakant, Lahariya, epidemiologist, is with us. He's been calling the new policy on testing forward-looking and well thought out. Dr. Sanjay Nagral is with us. Dr. Nagral is one of the doctors who signed an open letter recently asking the Health Ministry to have evidence-based policies, including dispensing with arbitrary use of antibiotics and institutional quarantines for COVID. Welcome, Sanjay, to the program. And Dr. Shashank Joshi is also back after a long time. It's great to see you again. Shashank, of course, is a key member of the Maharashtra task force and has been at the front lines of the COVID battle. I'll start with you, Dr. Joshi. As a key member, in fact, of the task force, a state where, like other states, schools continue to be closed, though I know the task force is going to re-examine this in the next 24 hours. Where do you weigh in on the testing debate? Maharashtra is one of the states where testing has fallen. The center has written to many states, including Maharashtra. Do you believe that when a virus is in community transmission to the scale that Omicron is, testing even makes a difference?
So, Barkha, it's a complex matter. Now, as far as North India is concerned, there is a complete or a near total replacement of Omicron with Delta. So Delta has fully been replaced. And when the wave hit, the third wave hit, the Delta was virtually extinct from North India, including Delhi. But when you come to Maharashtra and even Mumbai city and many of my professional colleagues, they are still, having Delta. So we have a small percentage, anywhere ranging, if you go outside of Mumbai, the Delta is around 60% and Omicron is around 40%. Within Mumbai, probably it has gone up to 80-20. So when there is also Delta around, to suddenly make a sea change of a policy is a little disruptive. Nevertheless, you see 80 to 90% of people who were diagnosed in this tsunami-like scourge were asymptomatic people between the ages 18 to 59. And probably that is why what Chandrakant was saying is this is a forward-looking policy that we don't need to aggressively look out for the people and go for a symptomatic approach. And that symptomatic or syndromic approach has been adopted when community transmission of the Omicron has been accepted. So it's not an easy thing. Of course, for the purist, there'll always be a gap or a lacuna, and that's something which we recognize. But there are some inherent limitations of basic tests which are there for COVID. Number one, RT-PCR has a sensitivity of only 70%. So 30% of the time you can still miss it. You might be carrying the virus, harboring the virus, and you may still miss it. So you need to repeat it. Second is, of course, the so-called rapid antigen tests, which are now used a lot. They are also being, used. That will have only 30 to 50% sensitivity. And third thing is, most people now, for the fear of the administration, are either, sitting at home, self-quarantining and self-medication. And, that is also not absolutely correct. They need to report it. A lot of people have done self-testing and they have not reported to the authorities. So the numbers which are being put out, I don't know whether it's a true representation of it at all or not. And secondly,
Yeah, but can I ask you something? Given that all samples are not being sent for genome sequencing, and genome sequencing is the only way to know whether a virus is Omicron or Delta, at least to know for sure, how do we even know what percentage is Delta and what percentage is Omicron? And also, it's an important question because the treatment, the symptoms are different, and possibly in some cases, the treatment, if the oxygen falls, is different as well.
No, no, clearly the treatment is completely different. In fact, Delta is a much more sinister strain. It can desaturate. We have right now patients at Lilavati Hospital on ventilators with Delta. So clearly the treatment is different. Genomic sequencing is a research tool, and at least 1% of the population should have genomic testing done. So when the numbers are large, that 1% is also not being met with. And even if we are not able to do genome testing, at least we should do an S gene deletion test, which gives us an indirect clue that whether it is a Delta or not. That also is not very easily accessible. So clearly there is a gap there, but this is a research gap more than a clinical gap. But as clinicians, we definitely want to know whether it is a Delta or Omicron, at least in places like Mumbai and Maharashtra. It may not be completely pertinent to places like Delhi. But clearly, what is being seen in the US and Europe is that they have a large unvaccinated population. They have admixture of Delta at its peak with Omicron there, and which is why you are seeing a large mortality. Now, right now, the numbers to focus for them are hospitalizations with COVID, hospitalizations due to COVID, the people who are on oxygen, people on ventilator, and people who have died. And for that, we definitely need to see that the current deaths need a more audit. And in the next 2 to 3 weeks, we will clearly know from Mumbai data what is the death, what is the hospitalization due to and
Yes.
with COVID, and we can delineate it better. So right now, it's work in progress. I think it's early days, and it is premature to predict.
Okay, that's quite clear. Dr. Trupti Gilada, do we then need to move towards more testing, or do we need to actually focus only on those who are showing very, very specific symptoms? The new policy says that the asymptomatic need not test. And that is, of course, leading to those who may, as Dr. Joshi said, be testing themselves on rat kits, rapid antigen test kits, and not putting those in the system. But do these numbers have any meaning now? Not from a research perspective, but from a policy perspective. How many are positive?
So it has been very clear with Omicron that it just came with so much speed that whether people tested or they did not, we were telling everyone that if you have any kind of symptoms, you assume that you're positive. And one of the main purposes of testing is to break the chain. Now, when people test and they test negative, they obviously feel that it's negative, understanding that the sensitivity of both rapid antigen and the RT-PCR is low, and it did uh, give them a sense of like a surety that they did not have COVID, and people moved around. So right now we're telling whether you test or you do not, any symptom is COVID, and that way we can break the chain of transmission. We've seen with Omicron that the percentage of severe illnesses is very low compared to Delta.
But
So
Trupti,
yes,
can you really break the chain? Can you really break the chain? JP Mulyal, who's a member of the government advisory body on COVID, said to me, the test, trace, and isolate is now a worthless concept. Given the scale of Omicron transmission, that thing of containing, isolating, wo gaya. It's a thing of the past. The transmission is too widespread. It's far too contagious, and it's also not as lethal. So forget this old idea of isolating people to break the chain. Do you agree?
so breaking the chain doesn't mean you only break the chain after you test positive. So if people do have symptoms, they obviously should continue to isolate. And I agree that there will be a lot of asymptomatic people moving around, but that's also the reason why we still insist on universal masking, because if majority of your people out there are going to be positive but asymptomatic, they're going to continue transmitting the infection. And yes, with Omicron, we did see that the infection did spread further, but that wasn't because it was being spread by those who masked well. People were not masking well. Breaking the chain doesn't mean we only have to test and break the chain. Break the chain means even if you're symptomatic, you stay home. And with that understanding going forward, we'll have to find a middle path. We cannot keep testing everyone. That does obviously incur a cost. And for the non-COVID illnesses, it was becoming a problem where people coming in with other illnesses were either declined care or referred to other places where they would find COVID care. And that was one of the main inclusions in the ICMR guidelines, where care shouldn't have been declined
And
only because that.
And in fact, you're seeing the image of a man we met in a wheelchair outside one of the big public hospitals in Delhi. And even a simple thing like a rice tube installation, he could not get because the hospital was distracted by COVID. There was another man I met who lost his 3-month-old baby who needed a critical care surgery. I met a pregnant woman where the small hospital, she was COVID positive, refused to attend to her. So I'm really glad you've made this point about the non-COVID poor because in this wave, like in the previous waves, they are continuing to suffer, especially at our public facilities, but even at our private facilities. But I'm a bit confused because our schools continue to be closed, and this is a big bugbear of mine, at least. And Dr. Nagral, let's bring you in, especially in the context of the open letter that you and other colleagues have signed, calling for an end to the use of, medicines like azithromycin, ivermectin, doxycycline, calling for an end to institutional quarantine, etc. The ICMR finally seems to be paying attention on everything but schools. Now, the moment perhaps you test more, you will also see those numbers go through the roof, and they might create an alarm where none is needed, and it might further impact economic activity, social activity, educational activity. Is that smart at this point for this virus and this wave, Sanjay?
Yeah. So I think it's very clear that testing for COVID has various collateral effects, and when you now know that, although I mean people like Shashank are the experts, but you now know that a majority are Omicron. The fallout of the testing is what we need to look at. So it's not just about getting a test positive, but it's also about what it leads to besides the isolation, besides the fact that it leads to a spate of further tests. I mean, that's what we said in the letter, that everybody then gets a CRP, a D dimer, etc., and of course drugs and antibiotics. But there is also, I have had this experience twice this week where my patients who are to be operated, so hospitals have a policy of testing the relative who is supposed to, the attendant who's supposed to be with the patient. And two of these relatives or attendants tested positive. They were asymptomatic and the surgery had to be cancelled or postponed. So these are the kind of fallouts. Incidentally, when we sort of all hold forth on testing, there's been one point which I've been raising for some time, which is, at least from healthcare perspective, we want everybody to test all our patients who walk in. But I don't think the healthcare staff is tested regularly. I don't think I was ever tested. So there's a bit of now
Really,
excess.
is that the case that frontline workers are not being tested regularly?
Yes.
I didn't know that.
Hospitals don't test frontline workers. They just keep on testing patients again and again. If my colleagues want to differ with me, they're welcome to. So I think it's becoming a bit of a protocolized thing. I don't know what are the drivers. It could be the fear. It could be, but I think, Barkha, we slowly now need to recognize that there are drivers there are some commercial drivers in everything about COVID now. And I think we need to start recognizing the commercial drivers of COVID. Because I'm worried that even after Omicron goes, we test for hepatitis B, C, and HIV still in this country regularly. Every patient hospitalized in every facility. That's not recommended by the WHO. Nobody recommends it, but we test. So I hope it does not become a permanent thing, because there's commerce behind this.
Well, if there's commerce behind what's keeping certain policies alive, there's also commercial cost. And often it's the poorest, the lower middle class, the middle class. I covered a horribly tragic story recently of a man who lost his job because of the lockdown, and then he got run over by a drunk policeman, a Zomato delivery boy. So there are these human tragedies that we must not lose sight of. There's what's happening to the cognitive skills of our children as schools remain closed. And I will take that back to Dr. Joshi in just a moment. But Chandrakant, Dr. Chandrakant Lahariya, you've been arguing that this is what should happen. And when you first suggested it, there are other people, Dr. Mulyal, there was a ferocious backlash against, both of you in terms of this being somehow of a callous policy. Now the ICMR has adopted at least portions of what you've been arguing. But the health ministry is at the same time urging more testing. Isn't there a contradiction?
Well, there is no contradiction in that, because health ministry is simply saying that anybody who need to be tested should be tested. It does not say that you test asymptomatic. So they are reiterating the policy. But let's go back to the original point, and some of those have already been alluded to. One of the things is that only condition in which you say that test every individual is that if you want to achieve disease elimination or eradication or a zero COVID in this case. But we know that is not the scenario. Now, second thing is that what we need to remember that some countries are testing a lot, like ramping up rapid antigen tests and other things. But I have been repeatedly arguing that in epidemiology, in pandemic, the context matter a lot, and India's context is very different. India has a severe, like a high seroprevalence, high vaccination coverage, and then currently the transmission is very high. In that setting, as some other speaker have said, that almost everyone who is having symptoms is Omicron or COVID-19 positive. So there is no value in testing. Third point is that if tests can alter the course of treatment, that is helpful, but that does not alter the course of treatment. Asymptomatic or symptomatic, whether tested or not, are likely to follow the same clinical protocol. So there is no value in it. What was happening, and I think I agree with Dr. Sanjay Nagral that this is more of a medicalized or commercial interest, that now we have so many testing kits and so many testing.
But let me also argue it for a moment from the other side. Both you and Dr. Nagral have a cynical view that this commerce driving it. But let's not forget the demons of the second wave, where to, Chandrakant, before the second wave, this kind of exceptionalism argument was made. Oh, India has widespread herd immunity, almost herd immunity. The Sero survey seemed to suggest widespread sort of transmission of COVID. We thought the second wave wouldn't hit us. I think the problem also is that the government, the state and center are terrified of making those mistakes again.
No, that's not, there is no mistake in that. So what we need to remember, we cannot unleash the second wave every single time to argue any case. That's the one part. Second part is that in public health and medical care, there are two different things. In medical care, individual care decision is very different than when we are talking about the broader public health level. Now look at of course, it's not that testing every individual has no advantage, some benefit, but that benefit is very limited in comparison of not testing everyone. But let me count the advantage. One, that reducing the testing or optimizing the testing has reduced the panic. That's one. Second, it has freed up the testing resources so the people who are sick, moderate to severe illness, can get their report timely. Third, it will open the window for the discourse that society need to be opened up. So there are many indirect benefits, which are the public health benefit. Public health is not about individualized care. And here the individualized care benefit is very, very minimal. The public health benefit of reducing panic, freeing up testing, ensuring that non-COVID essential health services are back on the track. We can have a dialogue to open schools. So this is a policy decision which will have multiple benefits, and the risks are very minimal. Like, I would not say risk is zero. Of course, some people are likely to risk missed up,
yes,
but the benefits are far greater.
I think that's a very interesting point of the greater good for the greater number. Let me take that to Dr. Joshi. Dr. Joshi, if testing were happening, let's say the levels of last year, and we now know, I think the Indian Express reported this morning that testing is at 60% of the same period last year. The cases are reported cases are the same, which means the actual cases, can you imagine how much higher? Just do the math. If we are testing at 60% less and the cases are the same as last year this time, when the second wave was just about to start its surge, you can imagine what's coming. But if the people of India, who are not so immersed in the subject as all of you are, as I am, start looking at 1 million cases a day or maybe more, Chandrakant refers to this kind of panic. Schools will never open. As it is, we're having a terrible time convincing state governments and even other parents to open. Markets will never open. Public parks, which shouldn't be closed in the first place, will never open. Livelihoods will be lost. So there is a point of the panic that focusing on the numbers and increased testing can create. What do you say, Dr. Joshi?
So I think I buy that point completely. And I think there are two issues to it. Number one is that we have to focus on saving every life and saving people from severe disease. That's the current syndromic approach or symptom-based approach. If somebody is symptomatic, test and treat. There is no need to track. Tracking will automatically happen, isolate, and identify and filter the people who are vulnerable. Senior citizens, people who have underlying immunosuppressed diseases, people who behave like unvaccinated population, people who have serious comorbidities. Try to save their lives and ensure that they are monitored medically under medical supervision by evidence-based therapy. Unfortunately, in COVID space, it is predictably unpredictable, and the evidence-based generation is more in the realms of speculation and less governed by science. And that is why a lot of panic situations arises. So when you have to take some prudent policy decisions, these are some lacunae or drawbacks which we have, and we need to recognize it. For example, the economic engine, educational engine, there is no need to disrupt it. as long as we keep some protocols in place. Now, the fundamental COVID appropriate
Are you
behavior
are you
protocols
are
like
you in are you in favor? I'm sorry, I'm interrupting you. Are you in favor of reopening schools irrespective of how high the cases go through the roof?
I think in a couple of weeks, say in a place like Mumbai, say by around Republic Day, we should have our schools to be opened, and clearly that's something which we are actively considering. In fact, the pediatric task force met yesterday and they have clearly told the government that this is something which should be seriously considered. The mental health consequences of children not going to school for 20 months is huge, and therefore it has to be open. There is no question asked about it. And therefore, we need to recognize that we have to take some science-based decisions. At the same time, we have to be mindful of the fact that the schools don't become reservoirs. So we have to ensure that the school personnel are fully vaccinated. The children are, taught some basic behavioral rules. There is open air ventilation there. So fundamental basics we are forgetting. See, basically it's an airborne droplet virus. So it is the mask and the open air spaces. No, there is no point of having air conditioned school, which will circulate that air again and again and cause a spreader event. So we need to be mindful of some basic. But absolutely, I'm in favor that schools need to be reopened. You cannot keep them eternally closed.
But if you
Economic
keep
activity.
testing,
See,
but then
one of the reasons.
we need that
Barkhaji,
public policy.
yeah, one second. The reason this rapid turnover has been started after 3 days, if somebody is asymptomatic, and the first decision was taken by the CDC was for daily wagers. See, the daily wagers have to go back to life. There is no point of keeping an asymptomatic home for 5 days, and when he goes back to work, even if he's contagious, he is supposed to be double masking and taking due care and precautions so that there is no transmission there. So the responsibility is posed on a citizen that he is supposed to follow COVID appropriate behavior, and it is something which we need to self-regulate. So this is going to be the norm as the time goes by. Yes, the numbers may be huge, but at the same time, a hybrid model of schools can definitely start. And I think eventually a physical model, maybe a month and a half down the line, should start. So I don't see a major challenge in that at all. Even in the current wave.
Yeah, but can I ask you something? I mean, we have to
Yes.
mentally prepare our people for the fact that if you see these numbers going through the roof, there is no need to panic. Someone needs to have
Absolutely.
that clear communication. The other way is to go Chandrakant's way, that don't bother, just focus on vulnerable sections of the population, high risk sections of the population, and keep your testing up in those sections. Now, Dr. Nagral is saying the frontline workers aren't tested is one of the reasons that you cannot have essential services shut down. You know, a suggestion came from Dr. Gilada that if doctors test positive for COVID, if they're asymptomatic, they should be posted on COVID duty. And a number of doctors reacted very negatively to that. Oh, you don't care about doctors, you don't care about doctors. But he was saying that this is an out-of-box solution. You can no longer keep isolating those who test positive but are asymptomatic. Dr. Joshi, your quick response, and then I want the other panelists to respond also.
So all my resident doctors at Lilavati tested positive. And in a week's time, they are back to work. Two of the girls had to be admitted also in the hospital. So it's not that they are also doctors, and we have to continue work. Continuity of care of non-COVID care has to continue. There is no question asked. And some hospitals, Sanjay, do test, but it is again voluntary. Like I test myself with the rapid test every week, but it has to be voluntary and it has to be done because we are equally responsible. We should not be transmission hubs. But one thing is very clear cut, that we are overdoing something. If you are symptomatic, isolate. And if you are asymptomatic, follow COVID appropriate behavior and mask ourselves properly so that we don't transmit it to others.
I couldn't agree more. Sanjay, do you want to come in on that, Sanjay?
A quick response to Shashank. So for doctors, it is voluntary, but for others, it is compulsory. So, I mean, that's the problem. But just let me also respond quickly, Barkha, to one or two points you made. So you said that, number one, in the interest of public health data, this should be done. You also said that the government is worried about the second wave. So, people are tired, and there is reciprocity on all this. People will be willing to subject themselves to tests, provided they have the assurance that the fallout of the tests doesn't disrupt their lives. And there is a reciprocity. We cannot be appealing to the public health consciousness of people without, in return, giving them basic good public health care. So, this reciprocity is not there. So the examples of foreign countries and Europe and all, because we are not in universal healthcare, and their livelihood goes for a toss. So I think we must be mindful that people are now tired, and people are at their wits' end.
I think that's a very important point. And by the way, though we shouldn't borrow from the Western world as examples, there are two kinds of examples in the rest of the world. Countries that are obsessed with zero COVID, which is an absolutely mythical idea, and countries like Sweden today that have stopped any kind of travel proof at point of entry because they've understood that it's pointless. Travel is not what is making Omicron spread. Omicron is already in community transmission in all the countries that it had to be in. Dr. Trupti, one of the other big things there's been backlash to is this description of Omicron as milder than Delta. Somehow people don't want to even entertain this thought, at least for the vaccinated. There's no question it is milder, at least from everything we know diagnostically.
Yes, it's definitely milder because it has been shown that it multiplies in the upper respiratory tract more than in Delta and lesser in the lower respiratory tract. It's very difficult to tease apart the benefit of vaccination from the inherent property of Omicron. But over the last 8 weeks, it's clear that yes, vaccine has a benefit of preventing from severe infection, hospitalization, and death. And Omicron by itself is also milder. So there is no doubt about it. I mean, with the numbers that we are seeing, our case fatality rate and the deaths that we are seeing are low compared to what we were seeing in Delta. So there is no doubt. So just to come in on a few things about testing and just to take that forward, I think now we need to take care of lives and livelihoods simultaneously. In the Delta wave, we were just thinking of saving lives. Going forward, we know with Omicron, lockdowns haven't worked, travel restrictions across countries haven't worked. And if malls can open up, restaurants can open up, there's no reason why schools should be shut. The seroprevalence in children in Delta was the same as that in adults, which meant that they were getting infection anyways. And the fallout of not having them in school, we are just talking about the people in the cities, but kids who will never go back to school ever, and that entire generation that will be lost is something that we don't even measure. We only measure health in terms of Delta. So in terms of COVID. So our yardstick should change. It shouldn't be number of cases anymore. Our yardstick should now be what's the hospitalization rate? How many people are we actually losing?
But in that case, we do not need to ramp up testing. The hospitalization dashboards will speak for themselves. A lot of people are incidentally testing positive for COVID, just like in the UK. They come for something else. They tested and then they're found to be positive for COVID. So they're not being hospitalized for COVID necessarily. That's the other important thing to remember. I have just a couple of minutes left. Dr. Nagral, on testing more, yes or no? Where do you stand? And then Chandrakant, and then we'll close. Yeah.
Very selective testing. Ensure good care for those who have severe problems and get on with life. I think we are slowly moving towards universal precautions. It's a very old idea. But I think that's how it's going to be finally, universal precautions and get on.
Chandrakant?
I think we have enough understanding about this COVID-19 pandemic in India. Like, we cannot talk about other contexts, but in India, we know that this is not causing that kind of severe illness. We also need to be mindful of societal requirements. So definitely there is a need for a selective testing. Of course, keep doing testing in those areas where cases are rising, where Omicron is not that prevalent, but targeted selective testing to protect vulnerable. We also need to remember that we definitely need to change the parameters which we are using for tracking the pandemic. Most importantly, at current stage of pandemic, there is no value whether peak is over or whether peak will come. All because the testing is changed, but it does not matter. We know that Omicron or COVID-19 virus or SARS-CoV-2 virus is all around us. It's immaterial whether peak is over, whether there will be fresh peaks. So all we should do, we should be tracking that how well hospitals are prepared for this response. We should be focusing upon hospitals are not closed the way schools are not closed, and the non-COVID services are revived. We should focus upon the restrictions or night curfews are removed. So we need to focus upon preparing for a time ahead where we will live with the COVID. There is no reason to right now to think that it will cause a severe disease in any group in India, but be prepared.
Let me give the last very brief word to Dr. Joshi. This business of night curfews in Delhi, restaurants have moved, for example, only to take out. Dr. Joshi.
We have to start living with COVID. I don't think all these work. They are all transient, temporary measures. There's no science behind all this. I think it's time that we start living with COVID, thinking that COVID is going to be a part of our lives, protect the most vulnerable groups and ensure that their lives are saved, and get on with our economic and educational activities. And I think, it's like we have to be resilient enough and we are strong enough and we have reasonable science to back it up.
Well, I think there's rare unanimity on this panel that actually the government nudging higher testing isn't going to achieve anything. It would be much more worthwhile to build a national dashboard for hospitals, one we actually do not have. There's a big data gap there, and perhaps that's where our energy should be focused instead. And yes, zero COVID is a myth. And finally, we hope, Dr. Joshi, that Maharashtra leads the way in opening schools. I know the task force is set to take a decision on that in the next 24 hours, so really hoping for that decision. Dr. Nagral, Dr. Joshi, Dr. Lahariya, Dr. Gilada, thank you. And to our audience, see you tomorrow. Thank you for watching. Goodbye.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.